Our young nurses in Gauteng say they've had enough, and Labour Union DENOSA has threatened that its members will demonstrate against the province's health department. Why? Well, unpaid salaries in the last 3 months and the retrenchment of some members. The department has promised to pay all outstanding salaries by today. We're joined now by Basani Baloyi, the Deputy Director General for Corporate Services at the Gauteng Health Department. She joins us now on the line. Ms. Baloyi, thank you very much for your time here on All Angles. Now, firstly, the department spokesperson was quoted in the media over the weekend saying that some of these salaries would be affected today. Has this happened?
Good afternoon. Yes, we have started, working on that, and we hope that, by the end of today, they would be paid, most of them.
Why were they not paid in the first place?
Maseko, this is the problem that, we have been experiencing as the Department of Health, that it's not only systems glitches, but also, budget challenges that we had.
All right. But, these people, 50 people in total, why them? Why this particular group?
Maseko, to put the matter, in context, it's not only 50 employees that we were talking about or post-com-serve nurses. We had around 727 for the 2021-2022 cohort and an additional, cohort of over 500, this year. So with these challenges that we have, some of the facilities were unable, to address the issues timeously. And these are mainly around, 3 facilities or institutions that could not find a possible way in terms of addressing this issue.
All right. So in terms of, what Mutalatala Mudiba said to the media over the weekend, he said with these 50 that he was quoted talking about, specifically 7 of them, their mandates, he said, needed to still be corrected. So he also said that maybe their salaries would not be paid today. Their mandates still needed to be corrected. Just help us understand that, because if it's people who have already been in your system and working for the department, why are we correcting their mandates now?
Maseko, this normally happens that, for instance, you will find that, the ID number might not be captured, correctly, or the name or the surname, and the system might reject it based on that, or it could be an appointment code that could have been erroneously captured. So it's a combination of many things. It's not really the people that are capturing, but it could be the information that either the employee or the HR managers in a facility could have sent that is currently not correct in terms of what we already have in the system.
Okay, so just to clarify this for me, in terms of maybe their IDs being put in the system incorrectly or a number missed, etc., how did this happen? Are these people who were already in your system and were already getting paid previously and were not paid for this particular month?
These are the people that have not been paid, since March.
Okay. And before that, were they paid? Were they in the system getting paid before that?
Yes.
So how did the system able to pay them before and not the past 3 months? With the incorrect capturing, for instance?
Yes, it could be the incorrect capturing, or, missing maybe a little detail out of it, or you'll find that, there has been information that has been requested, from an employee, but that employee could not forward, certain information, because what we are talking about now, it's new appointments, through a different system.
Okay, all right. I needed that clarity. So in terms of them, asking that they be permanently employed, etc., is this going to happen?
Yes, we are going to appoint them, as professional nurses, as they have, concluded their post-com serve program. So we will appoint them permanently into our organogram or in our establishment.
Do you have any concern at all as the department? I mean, for instance, ESCOM workers have basically shown an example of, not adhering to what they signed, etc., even though they are essential service workers. They still went on strike, and South Africa sees itself in stage 6 today, even though it's not entirely their fault. But are you not concerned that that type of example that has been set and the anger that is boiling over among public servants, even those who are supposed to be rendering, for instance, essential services like nurses, will not adhere to that anymore because their livelihoods are also at stake when they're not paid their salaries in so many months? Are you not concerned about that?
We are definitely concerned, Masego, because of this problem, has been with us for the past 5 years. And, annually at this particular point in time, the department finds itself in this particular position. So it's a challenge that needs to be resolved. And if you look into, the issues at hand or the appointment of nurses, with regards specifically with post-com-serve nurses, it's only Gauteng that is appointing them on an annual basis. When you look at other provinces, they're not doing the same. So, but however, when you look at our situation, it's different because we've got a high vacancy rate of nurses, and also is the challenges around the fact that, the nurses that we are talking about today, we have funded, their training programs. But when you look into what we have been doing over the years, it was not supported, by an adequate budget. So we need to work on a long-term strategy as to how do we address these issues so that, our training program, it's informed by the current, demand and supply, of nurses. And we ensure that, we also realize, the return on investment on those training programs. So over the years we adopted, a strategy that is short-term and it's not sustainable. So it's time now that we review how we do things, how we plan, and how do we deal with the scarcity of skills around nursing in various occupational categories. And again, how do we make sure that, we plan accordingly, that, by the time they conclude, their nursing programs, we identify where the need of the province is with regards to the nursing, professions.
All right, Meba Sani-Baloyi, thank you very much for speaking to us here on All Angles. She's the Director General for Corporate Services at the Gauteng Health Department.